Welcome to our town hall. Welcome to the month of August. We're really in the heart of the summer season, and we are expecting a little lower turnout than we normally have to town halls, but we did want to make sure that we continued to connect with everyone and provide you with updates on what ACCESS and the ACCESS community is up to. We are going to record this town hall, and that is so that people have the ability to watch it asynchronously when they are able, and they won't get a chance to ask us questions, but they can ask offline. Okay, so perhaps we'll get started. Next slide, Stephanie. So I always reflect on how incredibly fortunate we are to live and work and also play on this land, especially in the summer. I think also I tend to reflect on this when that land is at risk, and we've had such a difficult time with wildfires in Canada over the last few years, including recently in Jasper. So I think it's important for all of us to recognize how lucky we are to be here, and to recognize that we share this land with people who were here a long time before us. And you'll see in the note there that 634 different First Nations communities, 53 Inuit, and 8 Métis settlements who have a really unique and different historical, cultural, and spiritual and environmentally sustainable connection to this land. So we really want to acknowledge that and thank those communities for sharing it with us, and also affirm our commitment at ACCESS to really working to build relationships with those communities and make sure that everything we do at ACCESS is equitable for everyone, but especially our Indigenous partners. Next slide. So a little bit of housekeeping. Those of you who have attended one of our town halls before, we use Slido to ask and answer questions. So you can go to slido.com and you can enter that code there, which is ACCESS-AUG Town Hall, or you can just click on that QR code and it will take you to the right place. So please feel free to ask questions. At the end of the agenda, we always leave time for an open Q&A, and we have a number of panelists who can answer your questions if I can't. I'm the executive director, Christine Williams, but I don't always know all the answers to the questions, and I really rely on our team to help with that. This is really a team effort. So please feel free to ask questions, and we will do our best to answer them. And we also do have a chat button, so you can comment in the chat. If you can, put your questions in Slido, because then we can share it with everyone. Next slide. Okay, so this is your practice. So hopefully that I stalled enough to give you time to log into Slido. So we have two trivia questions. I don't know about you, but I am acknowledged in my family as being an Olympics junkie. I really love watching the Olympics. So both of our trivia questions are about the Olympics. First one, which of the following is not an official sport in the Paris 2024 Games? Give it a second. Oh. This appears to be a pretty knowledgeable crowd. So the answer is correct, baseball, of all those things. So this year, I think it's actually called breaking rather than breakdancing. My children corrected me. And sport climbing and canoe slalom are all new. I look forward to seeing how those go. Okay, next slide. All right, second and last trivia question. In what Summer Olympic sport has Canada won the most medals? Give it a second. Apparently there are lots of swimmers in the crowd. The correct answer is actually track and field. So there you go. We all feel like, I feel like there's a lot of swimming coverage at the Olympics, but Canada's actually excelled of those categories that we've excelled in track and field. Okay, All right, so our agenda for today, we are going to start with a reflection, which I'll get to in a moment. But then we'd like to tell you about what's new at ACCESS, talk about our first progress report, some outcomes from that, and thank you again, all of you, for contributing data to that progress report, which we submitted to CIHR. We're going to share the very exciting news that we launched our website today, and then give a little bit of a preview about what's coming in the next 6 months. And then, as I said, we'll leave time at the end for an open Q&A. So next slide, it is my pleasure to welcome, actually, I don't know that she knows this. Welcome Venetia, who is a person with lived experience involved in ACCESS, and also the reason I got engaged with this. I don't know if you know that, Venetia, but I heard you speak about your story at another meeting, at a 3CTN meeting, and it was so moving to me that I realized that I really wanted to be involved in this initiative. So it's all your fault. So with that, I will turn it over to Venetia to give us some comments.
Thank you for those kind words, Christine. I didn't know that you were one of the faces in the crowd at that time. And just thank you all for this opportunity to be involved with ACCESS as an advocate and a person with lived experience, as well as sharing a reflection. When I was thinking about what I wanted to talk about today, I get, just a brief journey of how we came to Canada when I was a kid as refugees from a Civil War area, and definitely being in Canada is and being there as a kid, or being here as a kid, is why I've made it this far, getting to access our amazing medical system. I was diagnosed at 15 with osteosarcoma, 19 with a lung cancer recurrence that was supposed to only give me 6 months to live, and now I'm in my 30s. And then a lot more challenges when my doctor said the treatments basically bring us to the edge of death and back. Our bodies don't actually forget that. We're still dealing with that, even if we're checked and out of the pediatric system. And then in the last few years, dealing again with lung recurrence and permanent disability challenges from that and the treatment. And one of the often I reflect back on what happened in my life and the barriers, but something more recent that has happened and really gave me some clarity on why, with all the struggles and suffering I do experience, that access is so important to me. I had gone to an aftercare education day, actually graciously supported by the People with Lived Experience Education and Training subsidy that ACCESS generously offers. And I knew that I was going there to really learn about my own health, but also for my friends and peers and advocates, and what can we do next? And one of the sessions that was there just about what it looks like when survivors have been have been engaged in research for aftercare late effects into their 30s, 40s, 50s. And I was sitting at the back of the room, and I know quite a few of you were there too. And as our presenters started speaking, I slowly put on my mask and started crying behind that. Of course, I wanted the information, no matter how hard or traumatic it was to receive. But I think for me, the harder part was that almost 20 years from the start of my journey, that I was sitting there receiving it all in one dump. I'd never had access to a lot of the things that the presenter was sharing about premature aging, accelerated aging, that an average 30-year-old that was a pediatric survivor, their body and their brain is at an age of 63, and that the research is not widespread, that it seems to be concentrated, that most average survivors by the time they're 30 are experiencing a body of 63 brain. It seemed to be the missing puzzle piece that my friends and I needed to validate that there's research that actually proves that when we joke about our bodies being 70s and 80s and senior citizens, and that our brains don't work anymore and no one really understands us and we don't feel useful anymore. Like, great, we survived cancer, but what is our life even? It just felt like this puzzle piece of this. Yes, we've suffered a lot. And actually, the research shows that too, and we're struggling. And my personality is the type that will take that information and figure out, like, what do we do with it? And so even at the event itself, I started asking, and it felt like no one understood the urgency of what this means. Of, sure, you can be, do well in your teens and 20s and forward, but by the time you're 30s, 40s, 50s, you're struggling, like, and life is hard, and it doesn't seem like there's much for us out there, in terms of how we're supposed to continue thriving, and what was the point of getting all that treatment? All of those kind of questions that are hard to ask and think about. And so an Access People with Lived Experience meeting happened. And as the meeting was going on, I realized this is why Access exists. And this is why it's important to me. Getting all that information at that education day really clarified for me that I actually have just limited energy, and everything I do is an additional body cost of how I want to live. And so I had to start paring down what's important in my life right now to be involved in, and what was maybe a past season where I need to give back to myself. And I realized, yes, access. We were able to sit after this, after the meeting with Stephanie and Jenna and a few other people, and I was just able to talk with them for about 40 or 45 minutes late into their evenings about the research I'd heard, how frustrating it felt, how it felt like no one had the urgency to want to tell all these other young people and parents and caregivers in the system, so that they didn't have to receive the information like a huge dump, like me, with not much control over it. And through those 45 minutes, we were all able to just speak, be fully emotional, empathetic with each other. But also, I heard how much Access really cares about this, why access to this information as soon as it's been published is really important. Not it also involves what is the best cancer care. If this is the aftercare results, what are we going to do in Access about trying to make sure that more and more young adults are not facing such a hard life outside after treatment, long after they've gone from our specific continuum of care. And so that's why I'm here with these, this ellipsis, these question marks, these uncertainties about my body, about how others are going to get this information, how another Venetia and their parents younger are going to make different decisions, and knowing this information that life is really short, not just from the cancer itself, but throughout our lives. We might be alive, but the limitations make our lives really short and hard. And I'm just really grateful and honored to be a part of Access, to be able to share all this trauma actually with the team, and to be able to channel it into something that is actually useful and will help other people. And just to get to do it together, that sense of we're moving together, that this organization understands there's been so many gaps, and we're all here to solve it together. And so the name itself, everyone needs access to all kinds of information, all kinds of care, all kinds of aftercare. And this is just one other element that I'm handing to us, to all to share together in how will we really start taking the new research that's out and really changing and adapting and sharing it with people as they're age appropriate or their parents as we're older, so that we can really have better lives and thrive. And I think that's the core of what ACCESS is all about. And I'm so grateful to be a part of it. And thank you for sharing this burden, this with me, and to being on the same mission together. It really makes when life hard, knowing that other people are walking with us, a lot easier. So thank you.
Thank you. So thank you for sharing that. Thank you for introducing the idea of trauma, because it's something that we don't talk enough about, I think. I would say that we are the ones who are honored and grateful for your involvement in ACCESS and your commitment to ACCESS, Venetia. And everyone can get a sense of why she inspired me to want so much to be part of this movement, really, this community. So thank you very, very much for sharing. And we will do everything we can to fulfill those wishes and to do better for our young cancer patients. And that's a great segue actually to our mission and our why. And I wanted to start town halls with reminding everybody about the why. I almost Venetia's really reminded us about the bigger why, but I think that we are united in wanting to do better, and that our mission as an organization is that every child with cancer in Canada will have access to the latest scientific advances, diagnostic tools, innovative therapies, and supportive care, because we want those children to have better outcomes and quality of life. So thank you, Venetia, for illustrating that so perfectly and so personally. Next slide. Okay, so we're going to move into the sort of what's new section. And Stephanie's going to start out with introducing a new team member.
Hello, everybody. I'm Stephanie Grover, and I'm the director of ACCESS. And over the last pretty much year, we've been developing our ACCESS Secretariat team. Hopefully, many of the faces on the screen are familiar to you at this time. We have a program manager, a senior advisor of communications, some project managers, Jenna, Trisha, and now Julie has joined our team, and Simona. And we all love to be able to work together to further that mission and work all together towards accomplishing it as part of ACCESS. So we wanted to share with you some of the other new things that have happened recently, and so I'll go through them now. So this summer, we've had an ACCESS summer experience, and this was designed to create an inclusive and positive experience for trainees in the pediatric cancer community, some of whom were working on ACCESS-related projects and some of whom were working with other investigators. In total, there were 15 trainees who were involved across multiple provinces, and they had weekly sessions that were either meet and greet sessions with the executive director or co-chairs of ACCESS, but also bi-weekly meetings where the trainees got to present their topics of interest to one another, to practice presenting, to share information, and to create a network between them. Over the next few weeks, we will be working to survey the participants about their experience in order to help inform a future development of a summer research program, which the education and training team are working on, to hopefully be able to begin a more fulsome program in the summer of 2025. The summer experience culminated in a summer trainee symposium, which happened yesterday. And all of the trainees had the ability to present the work that they had been working on over the summer. It was a great success. It was very nice to hear everyone's research, and the trainees presented to 60 participants from across the pediatric community, and we did record that trainee symposium, so it will be a resource that will be able to be found and watched in the future by other people across the network and beyond. We've also been developing different documents and resources in the community. The Social Justice, Indigenization, and Inclusion Committee have specifically been focusing on a new access guidance document on the collection and use of socio-demographic and other potentially sensitive data. And so the rationale for why there was a need for this is that it's known that children from underserved and marginalized socio-demographic groups often have poorer outcomes in cancer and experiences. And it's important to be able to collect and document the experiences they have and the disparities in order to be able to help work to bridge these gaps that are found. And to date, there hasn't been a standard process or guidance broad spread about how to collect the data in the pediatric or childhood cancer community space in Canada. And so ACCESS has been working, especially the Social Justice, Indigenization, and Inclusion Committee, to try to start to address this gap and lead this charge. So the intent of the document that was created, which is accessible and will continue to be accessible on the ACCESS website, is to outline processes and recommended best practices concerning the collection, management, and the use of potentially sensitive socio-demographic and other data within ACCESS activities, to set clear expectations for data considerations across ACCESS projects at each of the stage of their development and implementation, and to provide resources and educational materials so everyone in the ACCESS community can learn and grow and be better at working towards collecting this data in a meaningful and sensitive and appropriate way. Another update is has been a working group that has been working on the development of a Persons with Lived Experience Advisory Committee. And this advisory committee will be advisors to the Senior Leadership Committee in ACCESS. They will consider how work and priorities of ACCESS implement persons with lived experience, to ensure that their voices and the diverse experiences are reflected and embedded in the work of ACCESS, and to be able to provide timely responses to issues and changes in the pediatric cancer community in Canada. A terms of reference has been developed, and shortly an application process will be sent out in order to welcome any members of the involved in ACCESS of the PWLU network or beyond to apply to participate in this advisory committee. And so that will be being rolled out in the near future, but we're very happy that these steps have been taken by a specific working group of persons with lived experience in order to be able to move this forward. Christine?
Okay, so also new, although probably more accurately coming soon, we are going to establish an external advisory board for ACCESS. This is a concept that was part of our sort of governance and advisory structure from the beginning, but we're just putting it together now. And the idea is that this is a group of people from outside of ACCESS who are going to help advise our senior leadership about how we're doing as a consortium, the status and progress of our activities, including our research activities and our achievements, and provide advice on everything from research to really organizational direction and innovations in pediatric cancer care. It will be fairly small, 4 to 6 people that we will be asking to join this. And they'll have quite a breadth of knowledge coming from understanding the breadth of our research from basic science through to survivorship, experience with patient and parent advocacy, but also people who have had leadership positions in large networks so that can provide us with organizational and strategic leadership advice. So we've identified people to ask. I won't share their names yet because they haven't said yes yet. But they'll be both international, so provide us with some international perspective on pediatric cancer, and also Canadian, so those who understand the Canadian context. So a mix of both. I was waiting for the website to be ready, so those invitations will go out next week, and we're anticipating our first meeting in late fall. Next. Okay, and then the other group, I think, which is new since our last town hall, but doesn't feel new because it's been active, is our sustainability working group. So as I think everyone knows, the funding that we have for ACCESS through the Canadian Institutes of Health Research is time limited. And we have always intended and are committed to establishing a long-term growth and sustainability model for ACCESS. So to help work on this, we've put a small working group together of people who are passionate and creative thinkers, some of whom are external to ACCESS, some of whom are internal, but many with experience in leading organizations in Canada. We're getting some help from this for this from ACCESS Health, who are the people who helped us with our last town hall, or sorry, our last AGM. And we're really, you know, I quoted one of the members here that for as long as children in Canada continue to develop cancer, we will need ACCESS, and that is really why this work is so important and why we need to make sure we have a long-term sustainability plan. So the outputs from this group will include advice on the organizational structure of ACCESS in order to maximize its impact. Also some identification of potential resources, which will include partnerships to ensure our long-term success. And all of this will be put together in sort of a strategic considerations memo that will be shared with our senior leadership committee and discussed and then actioned. So our next big meeting is actually, we're bringing this group together on September 9th, which is just after the American Association for Cancer Research pediatric meeting in Toronto. So we're hoping a few people will be here anyway. But we thought we'd have an in-person / hybrid meeting, but we'll try to bring some people in person to really kind of finalize this work and produce the thinking that will go into that memo. So we're sort of united in this idea of building a better future for children with cancer in Canada. Okay, so progress report. I'm going to turn it over to Helen, who has done the bulk of the work on this on this report.
Okay, thanks, Christine. Hi, everyone. And I want to thank everyone as well for all the work that was done. One of the requirements of our CIHR funding was an interim progress report, and it took a lot of work and effort from across Canada. All of our themes and projects really dug in to get all the information to us. So thanks to everybody who was involved, and of course to everybody who their work was presented in that report. And that report went to CHR in, I think it was the beginning of June now. But the really cool thing is that all of the great metrics and beginnings of success stories that were reported can be useful for a lot of other projects and uses for across ACCESS. And we wanted to just give you a snapshot of some of the cool impact that we learned about, or I guess we knew about it, but we didn't look at it all in that, all together in that report. The first piece is that, and one of the main pieces that we got the funding from CIHR for is to really build a network across the Canadian pediatric cancer community. And our network is now 750 plus participants, including all of you, which we are really proud of. A lot of you know that we're organized in 7 research themes that span the pediatric cancer continuum. We also have our 2 cross-cutting groups: knowledge mobilization, social justice, indigenization, and inclusion. And we have our driver project, which is profile. And all of these groups really drive a lot of the work of the network. I think, Venetia's opening really reminded all of us, and I think it's on all of our minds all the time, that the work that we're doing here is always centered, and our core is really focused on the patient and making things better for the patients and the children and the survivors of cancer. And because of that, the perspective of persons with lived experience has been important from day one for the network. And it was great to see and really sort of look at the numbers and understand that persons with lived experience are really involved in all aspects of our work. These are just some examples that I've included here, including members of our senior leadership committee, members of the sustainability working group that Christine just talked to you about. And one that I'll sort of highlight a little bit more is that all of our research themes and groups, they're led by, we call them co-leads, and they really drive the prioritization and planning of the work of the research themes and cross-cutting groups. And that's really a lot of the active work of the network. And it's really, understanding that 1/3 of those voices are PWLE, I think is really powerful, because that means that really important perspective is always part of the projects and the work that we do. So next slide, please. A little bit more, digging in a little bit more to that work that we do in those projects. So we're currently have 18 approved projects. That's really a little bit of there's a lot, even more work that's happening across the network. Those are the sort of formal projects that have gone through our review process, that are sort of organized bodies of work, we could say. There's a lot more coming. My last sort of count was, I think there are probably about 11, and I'm sure there are more proposals underway in various parts of the review process. And also, so on our desks in the Secretariat, and on many of your desks in terms of planning for more future work. So I know that 11 number, I'm sure, is much higher. It was, I think, exciting to see when we got all the data back from all our projects and our themes, that we have over 170 active participants. Those are unique individuals, because we're really lucky that a lot of folks are involved in a lot of multiple projects and themes, which is quite amazing to see the dedication to a lot of this work. But 170 active participants, and these are across our stakeholder types. So all different researchers from across the continuum, clinicians, PWLE, community partners, industry, and others. So it is really great to see that we really are a multi-stakeholder consortium, and also that pan-Canadian piece is really coming into place as well. Those participants span current numbers around 21 research institutions, that I'm sure will grow as we go, and across 8 provinces so far, and we hope that'll continue to grow as well. And we also, all these projects have done an amazing job of engaging collaborators within the community. We have over 40 collaborators of a lot of different types, again, including our pediatric cancer centers across Canada, and also several nonprofits, industry, and others. And we also have some international collaborators as well. And I think it's important to note here that this is just the beginning. We continue to grow our network, and we'll continue to engage with collaborators to move our work forward, and to really try to do the best for the kids. So next slide, please, Stephanie. Another very small snapshot, and again, those metrics were just a sampling. There are a lot more metrics that we gathered. And here's a couple of examples of some of I'll almost call them sort of the early outcomes, or outcomes of the first couple of years. And some of these have actually already come up. So the PWLE subsidy program that Venetia mentioned as well, that's been launched. That was championed by our education and training theme, and that's to support training and education opportunities for the PWLE community. We're really excited that that's launched and ready. So if you're interested, please let us know, and you can also visit our website for more information about that. And Christine talked about the ACCESS, well, maybe it was Stephanie. Somebody talked about the ACCESS summer experience. I sat in on the presentations yesterday. I won't say more than just that I thought the presentations were fantastic. Trainees, of course, are a really important part of our network as well. So it was great to see all the talks, again, across sort of the pediatric cancer landscape of research, which was really fantastic and cool to see. A couple of other highlights, and there are a lot more examples here. So, but we had limited time, but we've supported the inclusion of patients across Canada in an international pediatric proton-photon consortium registry. Really important for the inclusion of Canadian patients in that, and having that data to be able to be accessed by Canadian researchers and others to really understand utilization of those types of radiotherapies and for Canadian patients. And then we've also launched or supported the launch, and the champions there are the Cancer Biology Group. The PCMM, which is, I'll actually say the full name, is the Pediatric Cancer Model Mechanisms Network. So their expert registry is up and running as well, and as is the matching program that ACCESS has been able to support. And that's really facilitating research collaborations within the pediatric cancer space. So we hope that will bring a lot of value and new important connections into the community. And I'll say as well, again, this was a really, really quick snapshot. We're working on a bit broader of a snapshot in the form of an impact report. So stay tuned for that in the coming few weeks. Because we're really excited to be able to share our story and some of our early impact with all of you and with the cancer community broadly. And then since we're talking about projects, I'll take one more minute to talk about some of the recently approved projects. I think these are the projects that have been formally approved since we last had a town hall. One is a cancer biology theme project focused on understanding 3D and 4D DNA structure, and that's really to better understand the biology and identify hopefully novel therapeutic targets for high-grade brain tumors. And we know that will likely be applicable to other cancers as well. So that's going to be some really cool, innovative, and powerful research. We're also providing drug access navigation support. This is a lot of you may know the DANPO role, so we're happy to help support that role. A couple things I want to highlight about that project is that it's a true collaboration between two of our research themes. That's a clinical trials theme and the access to innovative therapies and optimal care themes. So we're really starting to see, and I think we'll see a lot more of that, the cross fertilization or the leveraging of expertise and interest areas across our research themes to really work on projects together. And another cool aspect of this piece is that there are a lot of community partners that have been and can continue to be involved in this drug access navigation support, and we're very pleased to be part of that. We've also recently approved a project that is developing a Canadian network to manufacture and deliver CAR T cell therapies. Again, this is really innovative capacity. I think this is going to be a game changer for Canada. So really pleased that ACCESS can help start that off. And then finally, a project that's surveying healthcare providers to understand access to novel therapies. And I think probably more information will come out about that in future newsletters. So, and that was an Access to Innovative Therapies and Optimal Care theme project as well. And I know there's a lot more projects coming. We're excited to learn about them, and we're excited to tell you all about them as we go. And I think back over to Christine now. Thanks.
Thanks, Helen. It's great. Yeah, super exciting to see these new projects. Okay, so I wanted to also share on the excitement scale, at least internally, we're super excited to have our website launched. It's been a big lift. It's a big website. There's a lot on it, and there's a lot in the back end in terms of functionality, so that we have sort of future-proofed other functions we'll need around education and training, for example, and providing platforms for that, some help with project management, sharing, etc. So I'm going to walk you through it a little bit, just so you can get a sense of it. And then, of course, we want you to go and explore it. This is very much just in time. It was only launched today, so we're hoping we've tried to test every glitch, but I'm sure there's something. Feel free to tell us if you find something. So this is just the sort of splash page from the website, and there are mirror sites, English and French, and we're really hoping that this will fill a big gap that we've felt around having a virtual community hub. I mean, a national network really needs a place to put everything and to share resources, and we are very much hoping that this website will help with that. And you see the URL there, accessforkidscancer.ca. Just a note that we made the decision early on with advice from our PWLE colleagues and also the Social Justice, Indigenization, and Inclusion group, that we would not use actual photography of children and instead go with illustration. And we engaged a Canadian illustrator, a fairly young illustrator, to do all of the original artwork and illustration on our website. So his name is Paul Covello. And if you want to look at more of his work, you will see it. And those of you who have young children may recognize a lot of his work because he is actually a children's book illustrator. So just a little bit about navigation. So I'll walk through sort of what you'll see, but at the top screen, you'll see the usual kind of website things about us, our work, resources, news and events, and get involved. And then we have a search function at the top and also, of course, connect with us. So if you click on our work, as circled, this will pull you to this page, which talks about what we do. And a little bit more about our mission and what we're trying to achieve, and also some other areas and then organized areas of focus. So you can see the 4 that we have at the moment there. And then if you click forward one more. So if we go to the research themes and groups page, this is what you'll see, another illustration from Paul. And this is where you'll see the work of our 7 research themes and 2 cross-cutting groups listed there together. And if you click, Stephanie, so you'll see if you click the plus button, you can expand each one and you'll see a little bit more about cancer biology and what their goal is. And then you can learn more by clicking there. And that will take you to an expanded page that will give you the names of the theme co-leads, a little bit about cancer biology and why it's important, the aim of the group, and then their specific priorities. And this page also includes the projects that are now being undertaken through the cancer biology theme. There's 4 listed here, but you can expand that as needed to see more projects. So I'll give you an example. You heard Helen mention the PCMM, or the Pediatric Cancer Models and Mechanisms Network. So if you were interested in learning more about that, you would click there. And then that will take you through what PCMM is doing and who the scientific oversight or PIs or leads of the project are. So it gives you more information. Forward one. If you go back to that What We Do page, I just wanted to highlight this place for the Persons with Lived Experience Network. Also has their own button, and when you click on that, you'll go to a specific page that's for PWLE, and we expect that lots of content will be expanded in there as well in future. Next click. Each of the themes and groups have icons. And the reason we really wanted to do that was to help orient everyone to where the projects and ideas were coming from, but also show cross collaboration between the themes. So you see theme 1 through 7, cancer biology through to psychosocial and survivorship, each have their own icon, as do the 2 cross-cutting themes. And we'll use those throughout the website to help sort of orient about the type of work that's being done with each project. Next slide. Importantly, and I think it's come up already, there will be a section, a fairly big section of the website that is resources. So this is where we will put things like research papers that are published, videos, online courses or links to courses, toolkits as they're developed, and importantly, it will also have a searchable glossary of terms, and you can just see a snapshot of it there. It's searchable, so you can look up any term. This is going to be a living document. We'll be adding terms to this glossary. If you have terms that you really find on our website or find in your reading of pediatric materials and really wish that we had defined, please let us know. We will add them to it. But you can search through those resources either by theme or group if you're looking for something specific, or by the type of resource, or through specific tags, so it can help you find them. Next slide. Getting involved is obviously an important part of what we're doing to build a community. This is a public website, so although it's a lot about facilitating the existing ACCESS community, we also always want to be a welcoming place for people who are interested. So there are different ways to get involved, from subscribing to joining a committee, and I think particularly highlighting that people with lived experience have a place to find where they can join and connect with us. Next slide. Lots of ways to stay connected, both through spots on the website. So that clicking the connect with us, there's a subscription button in particular. As I just said, the get involved section, but there we also have social media platforms, if you haven't seen them already, on LinkedIn, Instagram, X, formerly known as Twitter, and YouTube. So we invite you to explore the website. We invite feedback. It already needs lots of updating because we had to freeze the content at one point and to get it all done. And then we have lots of new content and new projects, as you heard from Helen. So it will be getting lots of updates, but please send us any feedback and we're happy to adopt it. Next slide. Okay, over to Stephanie for the last bit around what's coming next.
So, as part of Access, there's going to continue to be people being invited and people being asked to help share information through presentations and whatnot to the entire network. And coming up on September 4th, we have a colleague, Dr. Marianne Mateos from Australia, who will be in Toronto and presenting a talk the application of precision oncology from clinical trials to liquid biopsy and beyond. And this information will be shared, this poster, through upcoming e-updates and to all. So please consider registering either to attend in person or online and to hear more, and more presentations will come in the future as well. So we just wanted to present 6 months from where we are at a glance. So as of today, we are very excited, as Christine said, that we have launched our website. And today we're having this town hall. There are lots of different engagement opportunities for many different stakeholders across the network. And so you can see those here with the red stars, various different meetings, both local, national, international meetings, where different people will be involved in going and speaking about access and learning more about how we integrate the pediatric cancer community, both in Canada and beyond. We have set a project submission deadline, and that this has been communicated across the research themes and cost-cutting groups of the end of October. And we're very much looking forward to holding our second Access annual general meeting in January of 2025. With that being said, please save the date. The date will be January 27th and 28th, and there will be opportunities for satellite meetings, probably before and after, that will work with the community to ensure that there's time and space for. And we will have opportunities to engage with people that we broadcast and invite people to participate in to help in the prioritization of topics for discussion at the AGM and some of the planning so that we can make sure that the AGM encompasses as much as possible what everyone would like to accomplish during those 2 days and surrounding them. So with that being said, I will leave the date up for another minute or two, just so everyone can take note. Again, it's January 27th and 28th of this upcoming year. And then we will go to, Christine, I'll let you say more after, but a Q&A session. So at the beginning of the presentation today, we put up the same Slido link. So if you already have it on your phone or on your device, it is the same one. If you have not had the opportunity, the Q&A function will be accessible at slido.com. Please enter the code hashtag ACCESS-ACCES Town Hall, which stands for the ACCESS-ACCES Town Hall, or use the QR code on the screen. So we'll leave that up for a minute. And it also will exist on this screen here. And we invite people to use that to ask us any questions.
So I think I haven't been watching the Slido, so I'll ask Jenna to let us know if there are any questions there that you want to promote. But well, if not, we'll give it a minute and see if anybody has any to add. I will share one technical thing we found, which is that there seems to be a problem using our firewall from IWK, or using our new website from IWK. So if you're in Nova Scotia, we seem to have a problem with the IWK firewall blocking our website. So we're sorting it out. So our apologies to our Atlantic colleagues. We'll try to figure out what's going on there. Thank you for pointing it out. I don't, so we haven't had any questions, so we're happy to let everybody go back to their summer plans, summer work, if that's at this point. And you are always welcome to reach out to us directly with questions. We've shared already, I think, all our social media handles, but you can also reach out to us by email at any time. And maybe we'll just take a moment to thank everyone for your participation, especially on at least in Ontario, a very hot, sticky day. And we look forward to our next interactions, both online, but especially in person. And look forward already to that cold month of January when we're going to have a in-person AGM. So we will engage you a little bit more on the planning of that, but we thank you very much for all your time and energy, and we'll let you go and just wish you a happy summer.